everyone, we're group 3 and we're presenting scenario 1 for our final presentation. Our clinical scenario was for a woman named Miki Suzuki, 39-year-old female, who presented to a walk-in clinic with some concerns that she had about some weight gain and fatigue over the last year. Her clinical exam did show some concerning issues about weight gain, high blood pressure, high levels of triglycerides, and high cholesterol. In the scenario, Ms. Suzuki reports using heated tobacco products 10 times per day over the past 2 years, with a history of using vaporized nicotine products for about 6 months for 3 years. She also reported that she works long hours at her busy job, which is primarily sedentary in nature, and she rarely has time to take care of herself or any leisure activity. There is a family history of cancer, but no family history of cardiovascular disease or diabetes. The goal would be to increase Ms. Suzuki's energy levels, decrease her body mass, and create a smoking cessation plan to help her achieve optimal health outcomes. The article that we were assigned was called The Effect of Heated Tobacco Products on Metabolic Syndrome, a Cohort Study by G et al. 2024. This was a cohort study conducted at the Korea Medical Institute from 2019 to 2020, and it included 183,870 participants. In this particular study, the participants were followed over a time span of 1 year to observe if there was an increase of incidence towards the development of metabolic syndrome, specifically with the use of heated tobacco products. On top of evaluating heated tobacco product effects, there were also other tobacco products that were included in the study, which was conventional cigarette use and electronic vaping cigarette use as well. And they compared the exposure group, which is the smokers, to the non-smokers. Cohort studies are longitudinal studies, meaning they follow a certain amount of people over a long period of time. They take people at baseline of disease and they follow through with them. In this study, we have the exposed group, which are people that were smokers, and then the non-exposed group, which were the non-smokers. And they evaluated whether smokers that were exposed to heated tobacco products, as well as other tobacco products, developed metabolic syndrome versus people who were non-smokers and their incidence of developed metabolic syndrome. Metabolic syndrome is a group of conditions that together raise your risk of coronary heart disease, diabetes, stroke, and other serious health problems. To be diagnosed with metabolic syndrome, a person has to have 3 or more of the following conditions: abdominal obesity, high blood pressure, high triglycerides, low HDL cholesterol, and a high fasting blood sugar. The criteria for abdominal obesity is a waist circumference of 40 inches or more in men, or 35 inches or more in women. High blood pressure criteria is a systolic blood pressure of 130 or higher, or diastolic blood pressure of 85 or higher. High triglyceride level criteria of 150 milligrams per deciliter or higher. Low HDL cholesterol levels of less than 40 milligrams per deciliter in men, or less than 50 milligrams per deciliter in women. And a high fasting blood sugar level of 100 milligrams per deciliter or higher. In section A, we'll be looking at if the results of the study were valid. So for the first part, we do believe that the study did address a clearly focused issue. The issue was, is metabolic syndrome linked to using heated tobacco products? Looking at this table here, it shows the characteristics of the study participants at their baseline from the beginning of the study in both men and women. It shows the average of the years of the men and women and the 3 tobacco products that they were assessing. So the conventional cigarettes, the vaping, and the heated tobacco products. It also looked at the characteristics of the lifetime use of the participant, their current use, the duration of their use in years, the frequency per day of their use, and the duration after quitting in years. The next question is looking at, was the cohort recruited in an acceptable way? We feel that yes, it was. The study appears to be recruited in an acceptable way, as the ethical approval of the study was done, and it was obtained from the Institutional Review Board of the Wuhan Women's University Seoul Hospital, and informed consent was also obtained from each participant. The way that the recruitment process went it was pretty straightforward. Health checkups and a self-reported questionnaire regarding each person's smoking status was done. The participants also needed to complete 2 health checkups with a follow-up period of at least 1 year from the initial start of the study. The exclusion criteria was that participants could not have any pre-existing metabolic syndrome complications or missing data from the health questionnaire. The sample size was quite large. It started with 183,870 total participants that visited the Korean Medical Institution in 2019, but a final analysis sample of 178,004 people remained after the exclusions were done, with 10,251 of those participants developing metabolic syndrome during the study. A recruitment size that large was good to have, as it provided a solid foundation for revealing conclusive findings. Now, some of the limitations to this was the cohort was selected from individuals who voluntarily sought out health checkups, which could create a self-selection bias, as people who attend health checkups might be healthier, more health conscious, and or have better access to healthcare compared to those who did not attend, which can potentially not be representative of the target population with regards to the final results. Additionally, the data collected on tobacco use for the study was via self-reporting, which could create some bias or misrepresentation towards self. The study is definitely worth continuing to investigate the adverse effects of heated tobacco products and the development of metabolic syndrome. This study did a great job at showing the correlation between the two and had some statistically significant numbers. And that is a big reason why we should continue to do research and get even more evidence to this, especially because these heated tobacco products are still being marketed as a safer alternative to cigarette smoking. There needs to be more awareness brought forth to the general public regarding this, along with further education being needed for healthcare providers for them to be able to help their patients and reduce their metabolic risks. Was the exposure accurately measured to minimize bias? We can't really tell for certain, just because of the fact that the exposure to HTPs was measured through self-reported questionnaire responses, which introduces the risk of measurement bias. Self-reported data is susceptible to recall bias, where participants may inaccurately recall their tobacco use, and social desirability bias, where individuals underreport behaviors perceived as unhealthy or undesirable. The study did not employ biochemical validation methods such as codeine or carbon monoxide testing, which are more objective measures of tobacco exposure. Although all participants were classified using the same questionnaire and procedures, ensuring consistency in data collection and the lack of independent verification raises concerns about misclassification bias. Misclassification could occur if participants inaccurately reported their smoking habits, leading to incorrect group allocation. Given these limitations, the accuracy of exposure measurement in the study is questionable. While the classification method was standardized, the reliance on self-reported data without objective validation weakens the reliability of the findings. Therefore, the final appraisal for this question is can't tell, as there is potential for exposure misclassification. Was the outcome accurately measured to minimize bias? We do feel it was, as there was an objective clinical assessment done rather than a subjective report, which helped minimize measurement bias. The study utilized standardized diagnostic criteria based on the National Cholesterol Education Program Adult Treatment Panel 3 guidelines and the Korean Society for the Study of Obesity. These criteria included waist circumference, triglyceride levels, HDL cholesterol, blood pressure, and fasting glucose, all of which were measured during routine medical checkups at the Korea Medical Institute, ensuring a validated and reliable system for detecting cases. Also, a clear and systemic approach was used to identify new cases of metabolic syndrome, as only participants who were metabolically active at baseline and subsequently developed the condition after at least 1 year were classified as having an incident case. This minimizes classification bias and ensures that the outcome measurement accurately reflects disease progression. For this study, we do feel that there were a lot of important confounding factors that were considered, such as age, sex, smoking status, dual use patterns, alcohol consumption, and exercise. However, there were other important confounding factors that should have been considered also that would have been helpful to include in this study that was also made of note in this paper, such as dietary habits, stress levels, genetic predispositions, socioeconomic status, and sleep patterns. Have they taken account of the confounding factors in the design and or analysis? Yes. Here are some of the ways that they controlled for confounding factors, one of them being the cohort structure. The longitudinal data collected from participants who underwent health checkups helped to track and assess the outcomes of developing metabolic syndrome with the use of HTPs over time. It was 1 year in this case. Also, the restrictions. The study excluded participants who already had metabolic syndrome at baseline to ensure that only new cases were analyzed. With statistical adjustments, the study employed a Cox proportional hazards model to estimate the association between heated tobacco product use and metabolic syndrome while adjusting for potential confounders. In stratification, the analysis stratified participants by smoking history, where they were classified as never smokers, former smokers, current smokers, in order to isolate the effect of HTP use. And with sensitivity analysis, this tested the robustness of the findings. The authors conducted sensitivity analysis including varying the follow-up period with a minimum of 12 months and excluding participants who had metabolic syndrome components at baseline. Was the follow-up of subjects complete enough? Unfortunately, it was not. Some of the participants were lost to follow-up. About 5,866 were excluded for not meeting the 12-month requirement. Also, with the study only being 1 year, it was a bit too short to capture the long-term development of metabolic syndrome, which the authors acknowledged that this was a limitation and did suggest that we would have got better results if the study was done over a 5 to 10 year period. There wasn't too much dynamically going on with the cohort study. It was a fixed group of people who visited the Korea Medical Institute in 2019 and were followed up in 2020. Some people were excluded or just voluntarily dropped out as they didn't complete the full study timeline. I'm going to be going over a few numbers and statistics in the next couple slides, just basically going over the results of the study. Overall, the study concluded that current users of HTPs had a 68% increased risk of developing metabolic syndrome with a hazard ratio of 1.68 and a 95% confidence interval of 1.25 to 2.26 compared to those who never used tobacco products. This indicates that current HTP users are significantly more likely to develop metabolic syndrome compared to individuals who have never used any tobacco products. Table 2 is directly from the study results that just show you the confidence interval of 95% and the heated tobacco product use from non-user as opposed to current user and how the risk increases. Table 4 has also been taken directly out of the study in the article itself, showing the effects of frequency of heated tobacco products that were used in 2019 and the development of metabolic syndrome a year later from 2020. And it clearly shows those using HTPs more than 16 times per day, they had a hazard ratio of 1.33, which represents a 33% increased risk compared to a lesser frequency. Now, all these numbers indicate that there is a strong association between exposure and outcome, as it shows that the longer the use and exposure of HTPs, the higher the risk of developing metabolic syndrome, and therefore this creates an urgent public health implication for the use surrounding HTPs. As you can see, the graph in figure 2, which again I have taken out from the study directly from the article, and it just shows you that HTP users have a 2.5 times higher incidence of developing metabolic syndrome compared to non-users. So it's quite concerning to see that just in a 2-year time frame, the level of risk that goes up the longer that you use heated tobacco products. Overall, the study was very well done and the results are believable. It can be applied to current day practice, regardless of some limitations that the study did have. It also fits with other available evidence studies, specifically the one by Shawarma et al. 2023, which was a 5-year follow-up cohort study, which showed the impacts of HTP on metabolic and respiratory health. This study does have implications for practice, as it does show significant evidence that the use of tobacco products of any kind, especially HTPs, do increase your risk of developing metabolic syndrome, which is a big public health concern because as healthcare professionals, our main goal is to help patients live healthier, more fruitful lives and prevent disease. And the more knowledge that we have, the better we can take care of our patients. The results can be applied to the local population to some degree. However, although the study does provide some significant insights into the risks associated with using HTPs dating back to 2020 in South Korea, there would need to be an updated study conducted locally to assess if the prevalence and patterns of HTP use have changed in statistically significant ways since then. Other dynamic contributing factors would also need to be included, such as population diversity, changes in public health policies, marketing strategies, dietary habits, stress levels, genetic dispositions, socioeconomic status, sleep patterns, and a longer study follow-up period for at least 5 years or more to be able to gather more conclusive findings and results. To relate this article to our patient in the clinical scenario, Miki, we would strongly suggest that she be encouraged to quit smoking, or at the very least reduce the frequency of HTP use, as even short-term smoking cessation efforts can incur health improvements towards reducing metabolic health risks. A smoking cessation program would be offered to her to help get her started if she was interested. It would also be advised that Miki seek additional support from other healthcare professionals, such as a registered dietitian or nutritionist, a personal trainer, and perhaps a lifestyle counselor to help her make important lifestyle modifications, keep her accountable to her progress, and guide her in a proper direction. It would also be highly recommended that Miki seek regular follow-up checkups with her regular physician every 6 to 12 months, if not more, to monitor her metabolic parameters, as early intervention can be key in preventing the progression of metabolic syndrome, which can lead to more serious health concerns if not treated appropriately.